Hello, everyone, and thank you for joining our third KNU online conference titled Relevant Pandemic Strategies from Outside. So the COVID pandemic has impacted everyone around the world and every sector of society and every aspect of how we operate on a daily basis. As universities, we have applied a variety of online strategies to engage students and keep their studies on track. Plus, we have all participated in multiple online seminars, sharing our successful practices and experiences and giving ourselves a pat on the back. However, universities operate in a somewhat protected ivory tower environment where our survival is essentially guaranteed. So perhaps we're missing an important outside perspective. How have other sectors of society reacted to the pandemic, where survival is really on the line? And most important, what can we learn from these outside strategies? So today's conference is unique, and we'll cover topics that most of us don't know much about. We all recognize that sending our students abroad gives them a new perspective about themselves. So let's take a look outside our normal comfort zone so we can take a new look at ourselves. Remember, this event is among friends, including the speakers, so we look forward to lots of questions. This means please don't hesitate to send your comments, questions with or without your name and institution. Otherwise, you're going to have to listen to my questions. So our first speaker today is Dr. Claire Fyvie, who is a clinical psychologist specializing in post-traumatic stress. Claire is the founding director of the Rivers Centre in Edinburgh, which provides a unique drop-in mental health service that recognizes the need for holistic healthcare that combines both mental and physical problems. She also started a special one-stop support service for military veterans, which has since been adopted nationwide in the UK. With the pandemic lockdowns, there's been a lot of talk and concern about mental health. As a result, Claire was asked by the Scottish Government to create an online mental health care website within 2 weeks, which she actually did. There's the power of the pandemic. However, mental health is an ongoing and important issue that also needs to be addressed and understood more seriously by universities. So I was really delighted when Claire agreed to share her insights with us today. Plus, she also happens to be my sister. So over to you, Claire.
Good, okay. Well, thanks very much for that introduction. I've been looking forward to this because I think it's fair to say that universities are not the only protected sector. And I think having worked in mental health for the last 30 years, I think we tend to be a bit of an ivory tower ourselves and don't often look around us to learn lessons from our colleagues in other sectors as much as we should. So I've been really looking forward to this. I think I'm going to learn a lot from the other speakers, and hopefully I can do my best to put across how the mental health sector has responded to the pandemic. Okay, so I guess you could be asking yourself, well, why look at mental health? The pandemic, COVID-19, that's a physical problem, isn't it? So why should we spend some time looking at the mental health reaction to this? So I thought probably the best way to start this is just underlining why this is important to your sector, working with universities, with students. Why this matters? Well, 50% of mental health problems are established by the age of 14. I think this is a fairly little known fact outside of mental health, that if you're going to develop mental health problems in your life, then these are likely to develop early in life. Half of them by the age of 14, 75%, so 3/4 by the age of 24. So the population, the student population, is a particularly vulnerable, at-risk population, just in terms of that's when problems are going to emerge, most likely. And also, just to underline the fact that I'm sure you're already aware of, is that suicide is one of the leading causes of death for college students. In fact, in the US, it's the second leading cause behind accidental death. But in some countries, it is actually the leading cause of death for this particular population. So mental health is something that I think we need to take very, very seriously if we're working with this quite vulnerable population. So I just wanted to try to explain some of the basics of this. Why would something that is a physical problem, COVID-19, why would that impact on our mental health? So just to give you a very quick gallop through the anatomy of how our brains work, why we would be impacted by COVID, here's a very schematic diagram of the brain. Our brains have been around for a very long time, and when we were living in caves, that middle bit, that core bit of the brain, I don't know if you can see me, this is one of the things that we miss out on when we're not face to face, but the core bit of your brain is like your fist, and then around that wraps the cortex, the blue bit in this diagram. So the bit that I want to draw your attention to is that very core, sometimes called the reptile brain, the bit that's been around since we've been living in caves. That's where our alarm system lives. And all of us have an internal alarm system. It's what helps us survive. It's what keeps us alive. And in a situation like a pandemic, this alarm system is likely to be set off. So it's like your brain is telling you that something is wrong. So you may have heard or read about the 3 Fs: fight, flight, freeze. These are the unconscious, automatic reactions that you will get to a threat or to danger. And this sends your body into a survival mechanism that keeps us safe, keeps us alive. And the pandemic, for sure, is going to have triggered this alarm system for many, many people. And then the other bit about the way our brains are built that I wanted to just underline for you is what happens when we're very young. This kind of age, you'll all recognize this. You've either got one of these at home or you'll know somebody who has. And this little chap here is very effective at drawing our attention and saying, I'm in distress, please do something about it. And as humans, we're hardwired to survive. We're not able at this age to look after ourselves. So we need to make attachments and bonds with our caregivers to make sure that they look after us and keep us safe. So this little chap here is signaling that he's in distress. And what will happen is, in most cases, a caregiver, whoever that is, will come and comfort the infant. And what the brain is learning is that distress and arousal can be regulated, it can be managed. And in particular, that other people are a source of comfort. And so what the brain is starting to do is connect in a way that really emphasizes the importance of social connection and relationships. It's all about relationships when you're this age. And that continues as we get older into adulthood. So by the time you reach adulthood, what we will all have to a greater or lesser extent is one of these, metaphorically speaking, a psychological first aid kit. So we're all going to have a set of strategies, a set of things that we have learned to do that help keep us well and buffer us against some of the challenges and the issues that we might come up against in life. So for most of us, these are the kind of things that we've got in our psychological mental health kit. And just working my way around the picture here, time with friends and family, this is the big one. And particularly for this age group, the student population, spending time with friends and family, really forging these social connections. These are the things that are going to keep us well. Getting outside, I don't know if this applies to you, but for a lot of people, connecting with nature, going for walks, just being outside in itself has a very, very positive effect on our mental health and well-being. Excuse me. And exercise as well. A lot of us take regular exercise and know that this is part of the package. This is one of the biggest tools in our toolkit, is being able to get out on our bikes, go to the gym. All of this type of thing is absolutely key. Exercise metabolizes some of the biochemicals that are released when that alarm goes off in our brains. Taking our holidays, taking a break, having some downtime. These are very, very important strategies. Getting a good sleep hygiene, having a routine, not taking too much caffeine before bed. Various things that help us get a good sleep at night. Absolutely essential. Putting boundaries around our work. So leaving work at home, leaving work at work, making the commute, getting home. This is what most of us have in our toolkit. So why am I telling you all of this? Well, let's just think about what's happened with COVID and how this may have impacted our psychological first aid kits. So instead of spending time with friends and family, just up here at the top left of the screen, what we've got now is separation and isolation, lockdown situations where we're separated from the people that we have the closest bonds with, potentially. Some of the mechanisms that we use, going to the gym, going out for bike rides, all these facilities have been compromised. Gyms are closed. I don't know what the situation is in other countries, but certainly in the UK, gyms have been closed for a very long time. And for a lot of people, that has been their main system of staying well. Flights have been grounded, so getting away, leaving your environment to get to somewhere to have some downtime. Again, a strategy that has been compromised. Poor sleep. And this is quite a sort of political symptom, if you like. Sleep disturbance is the most common psychiatric symptom, but actually in the context of COVID, it's likely to be caused by other factors, such as perhaps worry about losing your job, the end of furlough, these types of things, being in debt. These are the reasons at the moment that people are really struggling with their sleep. And then working from home. I don't know how many of you have had to work from home, but certainly most of us here in Scotland have been in this situation. And that brings particular challenges, as I'm sure you're all too well aware. So the point being really that the strategies that most of us have had in our toolkit have been compromised in a major way by COVID-19. And that's not surprisingly why we've seen an impact right across the board on mental health. And I've just pulled out some of the headlines that have been around recently, flagging up the very significant increases in the incidence of symptoms of depression, anxiety, These are the sort of big disorder symptoms that have been found in surveys and interviews for people. So fairly robust results in terms of noticing that there is this surge in increased symptoms. I wouldn't go as far as some of my colleagues in saying that a lot of people now have diagnosable mental health disorders. I don't think we're facing that scenario. In fact, what I think is happening is that our alarm systems have gone off, and quite rightly, a lot of us have had to adopt survival strategies, find new ways, but humans are very, very good at that. And I think there are lots of positives that probably don't hit the headlines in terms of mental health. So let's just, I want to tell you a little bit about how the mental health community has responded to some of these challenges. So the first thing that was noticeable from my perspective was a deluge of information. And we know that when you're faced by a challenging situation that's affecting your mental health, one of the things that you need more than anything else is good quality, accurate, reliable, trustworthy information. And certainly over here, there's been a rapid increase in the number of websites and other sources of reliable information that's been made available, particularly digitally. So here in Scotland, the top left here, NHS Inform, is a very substantive website, and you'll see if you have a quick Google around some of the mental health websites, they all have specific areas that you can click on. There's one here, coronavirus, COVID-19, and they take you into a domain that gives you specific information. Here's a collection of some of the resources that are available, particularly for young people, for children and young people, specifically aimed at that population to support their mental health. So you'll see that the health sector has been responding by collecting all the evidence-based information and putting it in a easily accessible location that people can have a browse and inform themselves. And then in terms of the workforce and looking out for staff, protecting staff, there's been a whole raft of interventions and new projects. So locally, one that I've put here, Project Wingman, this was a very nice collaboration with one of the airline companies, and what they created in the major hospital in Edinburgh, the capital of Scotland, was effectively like an airport lounge. I don't know if you can see the very smart gentleman here with his uniform on. It's the kind of lounge you would get if you go onto a plane and turn left, the sort of first class. I've never had that opportunity, but one of the lounges that you would go into while you're waiting for your flight, they recreated that within the hospital. So all the hospitality, drinks and places to relax in comfort have been created for the hospital staff under Project Wingman. A very nice, creative project there at the Royal Infirmary. Lots of the hospitals have created what they call wobble rooms. So this is really when people are feeling like they're right at the edge and they've had enough and they need somewhere just to go and take a few minutes, take a moment, as it says here. Lots of training, new trainings. You can't move new courses and opportunities to learn about how you can deal with the challenges of COVID in your specific area. Lots of teams have set up, whether it's WhatsApp groups or other types of informal ways to pull together and socially connect. The whole country here, I'm sure this is the same in other countries, the whole country has really got behind health workers in particular. Thank you, NHS. NHS is the National Health Service, the state funded health service here in the UK. This one here was a helpline that was very rapidly set up here in Scotland. That was the service that I have been working in, ran that one. Again, just a helpline that people can phone if you're struggling with any issues, not necessarily related to COVID, but anything that you're having trouble with. You can dial this line either anonymously, or you can give your details, and you will get help and support there. The Vibe Clinic, again, a very nice intervention where they had live streamed little exercise classes and music and things really to lift your spirits that you could tap into as a health worker. And then there's been a big push on psychoeducation, so for the workforce, so really trying to get people to understand what your early warning signs are if you're starting to struggle with your mental health. These being some of them here you may recognize: poor sleep, feeling on edge, avoiding things. So these types of signs and symptoms, if you don't know what your early warning signs are that your mental health is being affected, then I suggest you ask somebody who knows you well, and they will tell you. If you ask my husband, how does he know if Claire is a bit stressed, then he'll tell you, oh, she becomes monosyllabic. So he'll say, what's wrong? I go, nothing, I'm fine. So you may recognize that kind of thing. So know what your early warning signs are. So, and something that Lorne alluded to in her introduction, she said that we've been asked to create a website, and indeed the Scottish Government asked us, would you create a website to support the health and wellbeing workforce right across Scotland? So that's several 100,000 of a workforce. And can you do it within 2 weeks? We asked for 3. We said, can we have 3? I look back and I think, I don't believe we said, can we have 3? And they said, oh, okay. And so this is what we created. It's called the National Wellbeing Hub. You'll find it on Google if you look it up, National Wellbeing Hub Scotland. And it's really just a collection of all the things that we know support your mental health. It's particularly tailored for the health and social care workforce, but a lot of it applies much more generally across the board. So it includes things like, you'll see here, any free apps that can help, how to build effective teams. Here you'll see at the top right here, local services. So if you click on an area of the map of Scotland here, that'll take you to a list of services that are available in your local area to support your mental health and well-being. So it's an attempt again to bring everything under one roof, as it were, digitally, to make it easy for people to access. And then how have we managed to try to support our patient population? Well, as I'm sure you've done in academia, we've gone online. So we have, it's a system called Attend Anywhere or Near Me. And so we see our patients over the screen. Here's a GP here. There's been a big public health campaign called Clear Your Head, and that's been advertised on the television, on the radio, and through social media. And then there are these things that have started to grow up. Here's 2 examples, Kooth and Togetherall. These are called learning platforms. And you're probably aware of the concept. They're already widely used, I think, in academia, but definitely in the commercial sector. But it's relatively new for us in mental health. But these are ways to harness the power of peer support. Remember that crucial role, that social connection, from the time we're infants right the way through to adulthood. The crucial role of social connection in keeping us well. And these are just digital vehicles that allow us to harness that social connection. So this is my last slide. I'm just aware of time, but my last slide is just to underline, you know, when young people are at college or university, and particularly when they're away from home, this is what's going to keep them well. These conversations with their peers, having a coffee, getting in touch, meeting up, mixing in lectures, whatever's available to them. And if they're not able to do that face to face, then they're going to need as much opportunity as can be provided to do this online. That peer support, that buddying really, really needs to be emphasized. And alongside that, I would suggest, because of that importance of that bonding, that attachment, that one-to-one relationship, I would suggest that students have a named person, a tutor, a mentor, doesn't matter what you call it, but somebody that they know they can go to, who's sort of vertical from them. So you've got your peers that they can reach out to, but you've also got a named person within their academic institution that they can contact if they need to. Most won't. Most will do a good job of keeping themselves well. But I think for those vulnerable students, they need somebody that they can get in touch with. So they're going to need to know a name and how to get in touch with them. They need somebody who can be accessible to them. So I think that's all I would have to say, but it's a big area for us, and some would say it's taken a pandemic to shine a light on how important mental health is, not just for the well-being of individuals, but for communities, for society. And there have been lots of opportunities that have come in terms of mental health, lots of opportunities, not just in terms of raising awareness, but embracing what digital mental health can offer us. So I'll stop there.
Thank you, first of all. Brilliant. It was great. And I've got some comments here. Good to hear about what was happening in Scotland. And Lorne, I can't hear you. Right. Okay. All right. Anyway, we do have a few questions. So the first one is, since a lot of the listeners today are from international universities, there's an issue about international students who are outside their own culture. So there's a cultural isolation going on as well. Do you have anything that you could comment on that one? You know, how could universities help with that, especially for international students?
Yeah, I mean that's a difficult one, isn't it? Because one of the best things about learning away from home is that you are changing your culture, and I'm sure that's the driving force behind a lot of the reason why students will learn away from home. But I think the reality is there's a limit to how much other people are going to understand your cultural perspective, the difference in your own culture, where you're coming from. I guess it's just about giving that student opportunities to talk about how different things are in their own culture at home, making sure they've got every opportunity to preserve the links that they have with home and friends, family, you know, giving them the equipment that they need to keep those links going. I suppose what I would do is make it explicit by giving them opportunities to talk to their peers, to talk to their tutors, their lecturers about how different things are at home, and try and raise the awareness of the people that they're going to be relating to most closely. You could make, sorry, I'm just thinking off the top of my head now, but you could maybe create some, you could get the students to develop a little pack on getting to know me. These are the things that you need to know about my home country or the way things are done there, or these are the things that are going to be difficult for me. Or I suppose it's just, it's really about creating a dialogue and a conversation with the student, because then I'm just thinking of my own experiences of going to work in Bhutan and Romania and France and other countries, and it's not a sudden culture shock. Very often it's more a drip, and you realize on a day-to-day basis, oh, okay, that's a very different way to do that, or to think about this. I remember trying to do a survey in Bhutan, asking students, young people, about privacy. And they were looking at me as though, what are you talking about? What is privacy? And the penny dropped that they didn't have that concept. Everything in Bhutan is community-based. It's not about the individual. So they didn't have that concept of personal privacy. So these things are, you know, some of them will be positive, but some of them not so great. And I think it's just about them, students, having a forum to talk about these challenges that they may come up against as they happen. Sorry, that wasn't a very articulate answer.
That's fine. I actually have two questions here that I want to deal with before we move on to the next speaker, because one is from Matt Raskovich from Victoria University of Wellington. Hi, Mateusz. New Zealand. A lot of discussion and resources for academia focus on students and their well-being, and rightly so. What advice would you have for building up the resilience of academics, both from an occupational and personal perspective?
Oh heavens, that's a big question, Matt. I'm just thinking, when we designed the National Wellbeing Hub website, we very deliberately did it in two halves. One was for individual people, workers, and the other was for staff. And so it might be worth you having a quick browse on that website, National Wellbeing Hub, because what we tried to pull together is all we know is helpful for people maybe working in teams or working in an institution, or there's a whole set of resources there that I think would apply equally to academia as they do to health and social care. They're generic, they're principles that would apply to anybody in a work environment. So there will be some that are peculiar to academia, I would imagine. And I'm afraid it's not my area. I'm not very well versed, particularly in academia, but most of it will apply. So I would have a quick rummage around there and see if there's anything that might be helpful to you there.
And final question that I want to ask from Michael Collins, TU Dublin. Hi, Michael. Glad you managed to finish your class on time. He had another class, so he says, thank you, Claire, for a super presentation. Question: if one notices strange behavior from a friend or colleague outside the norm that might be related to post-pandemic stress, what do you recommend we do? For example, approach and ask if they've been affected without causing offense. So how do you do that? If you notice somebody, anyway, you get the question. That's an important one, actually. How do you?
Yeah, I think it is, and it's funny, isn't it, how these things de-skill us. Mental health, for a lot of people, feels a bit scary. Don't let it get in the way of you being a good friend or a good colleague. If you're noticing something that's not right, then ask the person, are you okay? Just open up a conversation, and you might need to do that more than once, because a lot of people will initially give the yeah, I'm fine. But I would ask several times if you're concerned, if you're seeing something that's just not right, and very often your gut is right when it comes to these things, then talk to the person. You're really not going to cause offense. I would just ask them very directly, and see if you can get into a conversation, and then figure it out. Help them figure out what's going to be the best way to support you and help you to get through this.
Well, thank you, Claire. Thank you very much for your insights and professional expertise, and for supporting us on this. And I know this is a topic that will be talked about a lot more, so hopefully we can do this again sometime. All right, so I am now going to move on to our next speaker. Our next speaker is Dr. Allison Pierce from the University of Northumbria in Newcastle, England. Allison is a long-time personal friend and collaborator with KNU, and specifically was the architect behind our very successful Kudos double degree program, where 60 UK students, yes, 60 British students, spent a whole year in Daegu, Korea. It was so shocking that even the British ambassador in Seoul came to see for himself. The secret was actually Allison's use of retro marketing, but that's another story. The key point is that marketing works, and the pandemic witnessed a variety of new marketing strategies to engage the massive new online audience. In the past, Allison was involved with the marketing campaigns for several major companies, including Boots the Chemist. So today, I'm really happy that she has agreed to share her insights on the innovative marketing strategies used by industry during the pandemic and how universities could learn from this. Over to you, Allison.
Hello, Lorne. Can you hear me?
Yes, we can.
Fantastic. Good morning, everyone. If it's the morning or afternoon or indeed evening, I dread to think what time it is for Mateusz in New Zealand. Thank you very much for inviting me to present at your international conference. I'm always delighted to collaborate with KNU. And I am just over what we in England call the Scottish border from Claire. So hi, Claire, I'm not too far from you. I'm going to try to share my screen now. I am at home on my not always cooperative computer and Wi-Fi system. So, Lorne, can someone just confirm that you can see that screen before I start?
Yes. Fine.
Fantastic. Okay, so I'm going to rattle through, not too fast, but fairly briskly. And then, of course, please ask questions in the chat or pose questions at the end, and we'll be happy to have a discussion. So my presentation is based on some reading that I did, and particularly an article published in the Harvard Business Review earlier this year, which was looking at old truth, new truth, things that have changed as a result of the pandemic, of the virus and the pandemic. And it's really interesting listening to Claire's presentation about mental health, because we are going to hear a lot about relationships and social connection. And change, and radical change, and very fast change is something which will stimulate that amygdala section of the brain, and give you a lot of danger and alerts, and we're going to see just how much has changed. So please be kind to yourselves. If sometimes you feel a little bit stressed, everyone is feeling the same. So the structure is around old truth, new truth. This, as Lorne said, is all about what's happening in commerce and industry. The challenge and the interesting part is how to apply this to academia, to higher education, to universities. And how you do that will depend entirely on the culture in your country, the nature of the higher education industry in your country, but we can debate a little bit about that. So the old truth has been for a long time that marketing is important. In the past, it was always manufacturing, production. More recently, it's been marketing. And now marketing needs to be at the center of a whole range of activities. So the focus is no longer purely on that marketing manager, director, that marketing expert. That person really needs to work across a range of activities and a lot of different people doing a lot of different things. And of course, universities are complex, large, diverse organizations. So this is particularly true in universities. Secondly, the assumption has long been that you need technology to drive success in marketing. Since the growth of social media, data mining, big data, and exponential growth in the sophistication and size of computing ability. I'm very conscious that there are several people from TU Dublin on this call, so I'm not going to claim any expertise in this area, but essentially you needed technology. And now again, the belief has expanded more that you need the right balance of factors for success in marketing, and that includes technology. So in the way that marketing has become part of a bigger picture, technology also becomes part of a bigger picture. And this example here, the 5-factor success approach, you'll find a lot of theories and frameworks like this trying to identify all of those different factors. So basically, the world has become bigger, more complex, and you need to be more interconnected and better at dealing with a lot of different things in marketing and in the use of technology. Just to give you a little idea of how fast things changed under the conditions of the virus, the pandemic, and the lockdown. And I am conscious that countries have experienced lockdowns in different ways. Maybe in the UK, one of the worst examples of what we've had to go through here. But these are global rates of technology adoption, showing the acceleration in the speed of change. So in e-commerce, generally, online commerce, things accelerated 10 years in only 8 weeks. So people are always forecasting how fast things will change and how fast technology will be adopted. So we made 10 years progress in 8 weeks. In terms of seeing your doctor, it took 15 days for telemedicine, virtual appointments to multiply by 10. The number of people in online meetings went up by a factor of 20 in just 3 months. I'm sure we all know that. And remote learning, 250 million students globally went online in 2 weeks. And I remember when this happened, we were given 2 days in the UK to put all of our courses online. That was very intense. There are always people who benefit from any kind of catastrophe. And here you can see that Disney Plus achieved in 5 months what it took Netflix 7 years to develop in terms of people online streaming movies and stuff. Of course, that's a second mover advantage. But anyway, this is just to give you an idea of how fast things have been changing. So you can imagine that agility That is the ability to pivot, and pivot means to change direction suddenly. Agility was always considered to be a technological process or part of a manufacturing, production, or new product development process. It's now a general marketing approach. You need to be able to change direction very quickly. And I've got an example here from Levi's, the brand we'll know from jeans, where they pivoted from please buy more and more and more jeans, this is their advertising message, to please buy fewer jeans. So they've pivoted from buy more to buy less. And you'll see that they're using the wonderful Marcus Rashford here, the England striker, very well known in the UK anyway, for his social campaigns to do with poverty. So they use him as an opinion leader. And here's a storyboard of the 30-second ad they've been running in the UK, where they talk about how the consumption of clothes has doubled in 15 years, that people need to buy better quality clothes. Good for Levi's because they tend to be a little bit better quality. When you buy better quality clothes, you can wear them for longer. If you wear your clothes for longer, you can buy less, and all of this is really good. So this is a very, very impressive marketing message, and I mean impressive in that it's extraordinary that marketers are now trying to get you to buy less in response to fast fashion. So have a little think about the messages that universities put out, and what would be the opposite message that you might want to start talking about. Another little illustration of just how fast things have changed. This is about what is sold online and how much things have changed here just in a year between March and March. Obviously, disposable gloves up 670%, but even some quite normal grocery items. Here are people doing exercise at home. Claire Fyvie mentioned the need to do exercise, etc., etc. And here are the things that really suffered. No one's playing golf, no one's going swimming, no one's going to parties. Again, this is just an illustration of how fast things have changed. So in the past, we always talked about attracting customers like trying to find a husband or a wife. Attracting customers is like dating, going on a date. And of course, now attracting customers is like online dating, because that online world has become so important. And I use this image. I quite like this image of people using masks, and it makes people more difficult to know when you do something online than when you do it face to face, obviously. So it's more difficult to get to know your customers, but even more important. So marketing has almost always been customer centric, always about your customers, and very important to know your customer. However, now more than ever, this has long been developing, but more than ever now, you must know your customer segment. And a segment is a smaller group of customers who share something in common. And there are various different ways of conducting a segmentation. And this is my little soapbox, really, as I really wish higher education and universities were better at this. So you can group your customers by demographics, for example. You can group them by their situation. You can group them by their attitudes, behavior, and values. That's called a psychographic segmentation. Or you can group them by geography, very simple segmentation. And these are more or less sophisticated ways of doing it. And here's Amazon's consumer segmentation. I mean, who isn't a customer of Amazon? So there's no point in them talking to everyone in the world in the same way. So they segment their market. And here is a beautiful segmentation for Amazon Prime, the express delivery service. And they're selling their services here to young women So this is a demographic segmentation with independent entrepreneurial attitudes, a psychographic segmentation. They have access to smartphone, that's a situational segmentation, located in remote areas or constrained circumstances, I made that up, such as a lockdown or self-isolation. So a very sophisticated four-way segmentation. And here's their advert. I do invite you to go to YouTube and watch the actual videos of these adverts. We just couldn't get them to work through Zoom. So here's Rapunzel's tower. It's got rather fantastic rap music going on in the background of this. Rapunzel, bit sick of being stuck in the tower, gets her smartphone, orders a ladder, which arrives extremely quickly. She jumps on a horse, rides off to freedom, founds a hairdresser's in this little medieval village, becomes extremely rich. Here she is, gorgeous and glamorous. Prime changes everything. So actually a kind of crazy, ridiculous situation, but very, very, very well targeted. So here's my connection with Claire Fyvie's presentation about relationships. Relationships have always mattered in marketing, but relationships are now everything in marketing. And that's an awful lot to do with the fact that our relationships have become strained. Either you can't see the people who you want to, or you're seeing far too much of the people who you don't want to. I know I've had a little bit of both. So have a little look at this 30-second ad, which is running in the UK again. It's called Here's to Love. Scenes of a young couple in the kitchen cooking together, another young couple cooking together, an older couple cooking together. I love the difference in the decor between these two kitchens, very well observed. Another couple cooking together, another couple cooking together. This lady's actually got no hands, quite remarkable. And then they sit down and eat together, this very comfortable looking evening scenes, beautiful lighting. Anyway, it's all people having a lovely time together. What are they selling? Basically, food that does not need cooking. So these are French fries, chips, burgers, and everything you put in the oven. And if you're me, you then forget about them and they come out black. But so this is all about selling relationships and not actually selling food. Number 7, I'm doing 10, by the way. Customers always hoped that you would have what they wanted when they came down to the shop. So they looked on the shelves and they thought, I hope you've got some toilet roll. And this was a classic product that immediately sold out in the panic buying at the start of lockdowns across the world. So these are real photographs. I've seen this for myself. There are no toilet rolls to be bought. This is hand cleanser and medications also out of stock. And you can see the people who work in the shop don't even bother to keep it tidy. The customers are throwing boxes on the floor. And so this is the situation in lockdown. So people could not find what they wanted on the shelves. Now that people are shopping online, they expect, and expect is different to hope, they expect you to have exactly what they want online. And I want to show you a little favourite example of mine. Waitrose is a very upmarket supermarket in the UK, a grocery supermarket. I don't often go there because it's so expensive. But anyway, if you put olives in here, you get 203 results for olives. Now, understand that olives are not normal part of a British person's diet, really. They come from Mediterranean, Greece, France and Spain. But nevertheless, you can scroll through all of the olive products, all the different variations that you can buy in Waitrose. Here's some more. Here's some more. Here's some more. There are more than 200 olive products online in Waitrose in stock, and I expect to be able to order them. So my expectations are now much, much higher than before the lockdown, when I would go to the shop and I would expect things to be out of stock. So customers, really, really important. Relationships, segmenting your customers so you understand and communicate with them in a way that's meaningful, and then also providing them what they want. So customers must sit at the heart of your marketing strategy, is what we always believed. Now we talk about a customer journey. Imagine what happened to the sales of chewing gum in the US during lockdown. They completely collapsed. You can see this here. This is 2020, the orange line. So each time the US locked down, chewing gum sales collapsed. And let's have a look what Extra did with that information. So why would people not buy chewing gum during a lockdown? Let's have a little look. This is a great advert. I really recommend that you go and watch this for a whole minute on YouTube. It's got a very romantic song by Celine Dion going on in the background. I won't try to sing it. It starts off with the deserted streets of an obviously American city, and people starting to hear the news that they are allowed to come out of their apartments. So this girl here is sleeping under a pile of pizza boxes when she starts to receive texts from her boyfriend. This guy here, he is people walking around in the corridor. He's actually clutching some toilet roll there when you watch it. People rush out of the house. They get into their cars, which are under this dust and leaves. Hundreds and thousands of people start to run out onto the streets. They break into the offices because they're so keen to get back to work. They're celebrating and cheering. And here's our girl emerges from under the pizza boxes into the park. She's looking for a boyfriend, but quickly puts some gum in her mouth because she wants to kiss him for hours and hours and hours, just like many other people here. He's hugging a tree. These people are about 80 years old. So people use gum to make sure that they smell sweet when they meet other people, and particularly if they're going to kiss other people. But also Americans chew gum to relieve the boredom of very long car drives. This is what I learned when I was reading about this. And of course, people were taking much fewer long car drives. Penultimate, everyone always assumes that you're competing with your competitors. So we try to identify them and understand them, anticipate and respond to what your competition are doing. Now you are competing with the last best experience your customer had. So that could be from anybody. So there's no point in looking at your direct competition and thinking, oh, well, this university does this or that. Your customer has been to the Apple store. And rather than experiencing this, they're experiencing this at an Apple store. And this is now their expectation of what everyone will do, even if you are not a producer and marketer of smartphones like Apple is. So very much more demanding than in the past. And then last but not least, the very important concept of brand values. Your brand was always reflected in your products. So there always had to be a very close connection between your products and brands. Advertising used to be about the features and benefits of products. Now, communicating brand values, regardless of product, is very, very important. So I'm going to show you again a storyboard of a TV advert for Santander Bank, a global bank, and think about, what does this actually tell you about what customers' attitudes to banks are? And if you're even a young adult, you'll know about the banking crisis. And think about, what values are they trying to communicate through not only the words, here's one, a bank for your ideas, but also the imagery. And think about, how credible is this? Because nowadays your brand needs to stand behind brand values. Look how strong the branding is. Here's actually an external shot with a lovely multiracial couple here having a lovely smiling chat with a banker. So is it credible, and what values are they trying to communicate here? So this advert features Jessica Ennis, who's a British Olympian, very famous and very well respected in the UK. This is Jenson Button, an international Formula One driver, looking rather handsome in his stuff. And they're talking about her values and his values. Here's a dad with his kid in the bank. The kid hands over some money, he's saving his money up. What values does that communicate? Here's a dad looking at his phone rather than into his baby's eyes. I don't recommend this if you want a healthy baby like Claire Fyvie was describing. But anyway, he's just scrolling through banking. And here's another dad with his kid getting some cash out of the machine. They're having a bit of a laugh despite the rain. And simple, personal, and fair are the brand values which are very strongly being communicated by Santander. So that completes my presentation. I hope I got my Korean right there. And I'm happy to listen to questions. I can't hear you, Lorne.
Yes.
Hi,
Can you hear me now?
Yes, I can hear you, yeah.
Okay. All right, we'll get it right. Thank you so much. Actually, I missed the British advertising. I think it's great. The jingles and everything, but it's so different nowadays.
Yeah. Well, you can go on YouTube and watch any of those if you're interested. I do recommend it because they do work well with the music and the voiceovers, yeah. Yes.
Did everybody catch that? So Alison's going to leave all those links. We will have this at the end of the webinar here. Yeah. Okay. A few questions for you. Okay. Universities have essentially a captive audience. So do they really need to keep up with market trends?
I think universities might think they have a captive audience once students have joined, and I do see some evidence of slightly lazy attitudes to students once they've joined. But I think increasingly universities don't have a captive audience before they've managed to recruit their students. So you may have a population of local students who you think you can rely on. But given the globalization in the industry, given the move online, which has made your competitors much more accessible, I think it would be dangerous to assume we've got a captive audience, we don't need to worry about this. That's increasingly not going to be the case.
And along the same lines as that, should we be treating students as customers?
Well, I'm a marketer by profession and I worked in industry. I do think there's a role for good communication, which is often what marketing is about. But I do have serious reservations about treating students like customers. The more that students pay fees for their education, and that does depend which country you're in, the more they behave like customers and the more we treat them like customers. And there are all sorts of implications of that, and I don't think it's always a good idea. So I think the idea would be to take what's good about marketing, the sophistication in communication, the effort that you make to communicate and understand the relationship with students. My concern is that it's very difficult to challenge and develop a customer, which is what we need to do with students, not always make life easy for them. But if you segment your market, if you group your students by their attitudes, their situation, then you will find a group of students who is at university in order to be challenged. And so you can always preserve that group and behave towards them in an appropriate way.
Okay, I have a question here from, let's see. We've got several actually. Paul Doyle from TU Dublin.
Hi,
what
Paul.
are the reverse messages you think are becoming popular in universities, like the buy less? Hi, Paul, by the way.
I haven't seen much evidence of this, Paul. This is pre and post pandemic. And I think this buy less idea is obviously hugely influenced by the whole debate about environmental protection and climate change. And to be honest, I think higher education and universities run behind commerce and industry, probably for the reasons that Lorne alluded to at the very beginning of the presentation about how we work in a rather protected area. So I haven't actually seen any of these reverse messages coming through universities now. I think it's just really interesting to start thinking in this way. And when I teach marketing, I give an example of tomato ketchup, that thick red tomato sauce. Certainly British people have it on almost every single meal. And it's produced by Heinz, the big American food company. And the problem with tomato ketchup, when it's good quality, is it's very thick. And it doesn't come out of the bottle. And this is a real problem for the product. And so they turned that disadvantage entirely on its head. And about 10 years ago, they started to market ketchup based on how difficult it is to get it out of the bottle. And they communicated this family ritual around the British tea table of people slapping the bottom of the bottle to try to get the ketchup out, and about how not only did this build relationships because there was a hierarchy, your dad always had the first go, but also that the mother, and these are stereotypes, but the mother was proud of the fact that she provided the highest quality, thickest ketchup. So you can take what is actually a disadvantage of your product and with a bit of imagination, turn it on its head. So Levi's are too expensive, but they've taken that disadvantage and turned it on its head and started to sell this message. So that's a creative process that you can go through within your organization to think, what are the disadvantages in my university and how could we turn that on its head? So if you come to the Technological University of Dublin, the courses are very difficult and challenging. Can you communicate that in a way where it actually becomes an advantage?
Right. Like KNU being in Daegu, not in Seoul.
Right.
But you know,
exactly. Yeah, be proud of your disadvantage, yeah, exactly. And don't hide it. Start thinking, what's great about that? Get out of Seoul. It's cheaper or
next
nicer.
One. This is actually from Claire, the first speaker. So she's saying, Claire. She's still here. Yeah. She's saying, hi, Alison, what is the best way to market mental health?
Oh my goodness. Gosh, do we even want to market mental health? Claire may feel even more strongly than I do about whether or not education should be marketed, whether or not healthcare service should be marketed. And again, I would say the same, that there's a lot of bad reputation about marketing, about exploiting people's insecurities, creating desires and then, charging people to fulfill them. But I just think about marketing as understanding your customer, segmenting your customer so you don't treat people all the same, and then communicating with them in a way that's most effective. And at the moment in England, certainly, and in the National Health Service, there's a huge debate about people want to see their doctor face to face, and huge pressure about we must be able to go and see a doctor face to face. Personally, I find that really, really inconvenient, and I'd much prefer to be able to talk to my doctor on the telephone. And so some of the things that Claire was describing about what they've put online, the telephone services and things like that, it's a little bit about making sure that your services are delivered and communicated in a way that appeals to these different segments. So I can imagine the people who really want to see their doctor face to face, and they can go and spend that time. But I really don't need to do that, and I don't want to. So please let me phone the doctor. And so I think that's my answer to that question about making things available to people in different ways, which Claire's already doing.
Could you just briefly explain about the segmentation you used for the students to inspire them to come to go overseas? Because I think this is what people are asking, how does this apply to a university sector?
Right. So
that's the last question, by the way, because we've got to move on. And I'm sorry to everybody who's asked questions, but we just don't have enough time this time. Go ahead.
Okay. Well, I'll people who've written questions in the chat, I'll answer those during the call. So don't worry. So yes, Lorne is talking about the way we try to understand the students who may or may not want to go abroad to study. And so we looked at the different reasons why students were actually coming to university. And there are people who are very instrumental and ambitious, and they want to achieve the highest things and get the most out of it, and they want to be challenged. And those were the kind of students who we talked to about going to Korea. And we really said to them, this is extraordinary, unique, and very difficult. And if you can manage to do this, you will be an elite student. So you're trying to appeal to that ambition and their confidence. But then you have students who really want to stay at home, or they must stay at home, or they just they need to be close to home. And we would talk to them, for example, about going to Ireland or going to the Netherlands, because it's not far, the cultures are similar, and my Irish friends are going to argue with me about that. The cultures are similar, and there are very easy and frequent travels. We looked at people who were trying to escape their home life for some reason, and we would talk to them about that. So we're basically just understanding the different reasons why people at a university, the different reasons why they would or would not go on study abroad. And whatever it was, we would tell them that message. So we basically communicated study abroad in 6 different ways. And that's what made it so successful, is we didn't talk about Korea to people who were never going to go to Korea for whatever reason. And that's very effective, because you're spending your time and money talking to people about something that they're interested in a way which interests them. So that's what segmentation is about.
Oh, we just got a post from Mateus. Let me just read this. He says, fantastic presentation, Alison. Plenty of food for thought. Here's a higher education marketing pitch from New Zealand. Escape the crazy world. Come to the edge of the world. Study in New Zealand. Yeah, there we go. You're reaching out. You're getting the message across.
Mateus from Slovenia. Slovenia always marketed themselves as being in the heart of Europe, which they basically are in many ways. And that was very effective. And they were always more successful in the UK in that respect. True. And so now Mateus is marketing his university in the opposite way. And that is perfect segmentation. Well done.
Okay, thank you, Alison. Excellent job. So now, finally, we're going to move on to our last speaker today. So our final speaker today is Dr. Troy Furman from our KNU Law School. Some of you may know him already. But Troy is actually quite difficult to introduce, as I'm not really sure what to highlight. He's a practicing attorney with experience on Wall Street and Las Vegas. And he was recently seconded to become the chief banking officer and general counsel for the Export-Import Bank of the United States of America. However, he and his family frequently visit me at my country home to help me with the garden. And it was during one of those visits when Troy commented that it would surely be big business, not governments, that would navigate our way through the pandemic. And actually, that's where the idea for this conference originated. So it's only fitting that Troy be our last speaker today. Therefore, as an avid American football fan and legal expert in financial risk analysis, I'm now totally delighted to hand over to Troy. Over to you.
Thank you, Lorne. I'm going to share my screen here. There we go. Delighted to talk with everyone today about COVID-19 risk analysis in sports and higher education. I'll try to make this as simple as possible and not get into anything too complex as far as models or anything like that goes. But I did want to highlight the fact that, yes, indeed, Lorne is correct. I'm an avid American football fan. And I just had a mosquito fly across in front of me. Anyway, I'm an American football fan, and particularly college football. My favorite team is from my alma mater, BYU, in the United States. And I did want to point out that when we're looking at the sports industry, particularly in America, that includes universities, which are a big part of big sports and big business in the U.S. when it comes to athletics. I'm going to talk a bit about crisis management, risk analysis, and adaptation, and comment a little bit about the missing the Olympic moment, which is actually a concept Lorne and I hashed out a while ago. To start this out, let's all go back in time, if you can remember this far, January 2020. Think about what did we know about COVID in January 2020? Not much. Headlines were calling it a respiratory flu, and then eventually it was known as the Wuhan virus. Mortality rates in Wuhan, China, in the period of December 2019 through March 2020 were reported anywhere from 8 to 15%, and this was according to the best data that was coming from Chinese scientific community, as re-reported by the National Institute of Health in the US and others. The disease was known to be transmitted from human to human, but exactly how contagious it is and under what circumstances it is transmitted at that time were not fully known. But all we did know is there were really scary things we were seeing coming out of China. As a result, as the disease spread around the world, not surprisingly, there was a lot of panic. Now, given such circumstances, normal process decision-making in most organizations collapsed, particularly as the virus came into your country. If you were facing an 8% mortality rate on a highly contagious disease, what would you do? Well, it's not a hypothetical question, because the real question is, what did you do? And what did your organization do? Most people and most organizations did what humans do in a crisis. They reacted with emotion and basic instincts. And mission statements, cooperation agreements, and other such niceties went out the window as just basic concepts like self-preservation kicked in. So once again, I asked the question, what did you do? Did you hoard toilet paper or hide from civilization? Did your organization shut down classes, your university send your students back home with little or no warning? Then the question not only is what did you do, but then why did you do it, and how did you get to those decisions? Whose opinions mattered? Was it professors, administrators, students, other stakeholders that you may have, lawyers or PR professionals? Did you consult medical professionals, particularly those in academic circles? And what data, if any, were you looking at or modeling? I don't find much fault with a lot of decisions that were made at the spur of the moment, particularly with very incomplete data in early 2020. Clearly, some decisions were a bit bizarre, and looking back in particular, I keep asking this question: who had the brilliant idea to shut down universities and send their students back home in the middle of a pandemic? Probably lawyers. And indeed, when I've talked with people I know in American universities about their decision to do just that, they said, yeah, it was the lawyers that gave them the great idea to send students home and possibly spread the disease as they scattered around the globe. As a lawyer, I can tell you, don't always listen to lawyers. They don't have the best ideas. Okay. Now, with respect to organizational crisis management, that's the mode that we were in at the beginning of the pandemic. And I want to distinguish between crisis management and then just general risk analysis. Of course, when we're in crisis management mode, we are thinking about risk analysis. But when we get past the initial crisis, we do have to pivot into an adaptation in dealing with the crisis at hand. But at initial crisis management, we're looking at responding to and managing and recovering from unforeseen circumstances like a pandemic. It's really important, though, that we don't rely on fear or other emotions in making our decision. And that's really difficult, particularly if the event, the threat in this case, might affect us personally. Now, but it's critical to make decisions using the best processes while gathering and assessing the best information available. COVID seemed very scary, and of course, organizations of all kinds reacted. And I emphasize the word reacted. Not necessarily thinking clearly, not necessarily engaging in good and analytical practices. And as a result of COVID, and I'm not saying that this is a result of bad analysis, but remember, not too long ago, this is what the world looked like. Empty recital halls. The middle picture I have here is empty streets in New York City leading up to Grand Central Station, and also empty store shelves. There's something I would like to think about, and this will come in handy a little later, is thinking about in business different types of industries. In the background is a picture of an office, the type of office that many people, maybe even on this, might have worked in at some point in their lives, where people could leave their offices and go home relatively easily and work from home. In the foreground, in that circle, is a picture of a factory that was shut down in Bangladesh due to the pandemic, and many people lost their livelihoods as a result. Very different results for very different people in different industries. But in higher education, in sports and other industries, sometimes within the same industry, we had different people that had disparate results taking place because of their job functions. Now, my main focus here is talking about sports, which is featured on the left, a nice football pitch there from England, and then on the right, a nice classroom I picked up from a university in North America. But at the beginning of the pandemic, this is what everything looked like: empty, empty, empty. And a lot of us looked and felt like this. Remember that last year? We were thrust into an emergency situation, teachers who had never taught online suddenly being told, oh, you have a day or two, or maybe a week if you're lucky, to get online classes going. And in many instances, we were shoved all online and into isolation. I often felt like the person pictured here, as I'm sure many of you did. But I believe this went on far too long and has gone on far too long in the higher education industry due to faulty analytical processes and management. As a result, we've had sad students, sad professors, and sad people much longer than maybe we needed to, and we know about the mental health issues that come out of that. I'm not going to comment further on that. Now, the main focus of this presentation is really to talk about the sports industry and maybe what we could learn from that in higher education. First thing to think about is the different motivations and risk tolerances between the sports industry in general and higher education in general. And then within those two industries, think about how different institutions or organizations within them also have gradations of motivations, such as profit motives, or risk tolerances due to the organizational cultures, or even just their missions. Other things to think about generally when we talk about risk analysis, of course, would be the analysis processes and then the different results that come out of these. Now, different risk analysis processes have been clearly evident as I've interfaced with individuals involved in the sports industries and higher education in various parts of the world. And frankly, higher education tends to be extremely risk averse. And as we know, it lags behind industry in many, many ways. But as we've seen in the COVID epidemic, many higher education institutions went from risk analysis to just pure risk avoidance. Higher ed also failed to amazingly utilize experts and try to solve problems in ways that industry did. And it's remarkable because we're supposed to be full of the so-called experts. Ultimately, sports organizations did a better job of assessing information in order to meet the needs of their various stakeholders and to take really more holistic approaches to dealing with the pandemic and working through it to a point of better adaptation. Let's face it, most professors and administrators we know, at least most of the ones I know, were perfectly happy to hide behind computer screens as long as possible, even long after science told us and showed us that in other industries you could get together and do a lot of things that universities just took a lot longer to get around to doing or maybe still aren't doing. And so we failed to take advantage of our classrooms, our laboratories, and our various field research environments. And we failed to allow our stakeholders to do the same. And the results speak for themselves. Athletes returned to the courts, to the fields, to the arenas, to the rings very quickly in comparison to how we've returned to classrooms, to our laboratories, or other environments in general as an industry. Now, while athletes were training and competing in person, we largely stayed behind screens once again and failed to allow our students or other stakeholders to take advantage of our various facilities and our various capacities. I think part of this comes from differences between leadership styles and just what's expected of leaders in our two different industries. One of the big failures, I believe, in higher education and in other types of particularly large bureaucratic organizations is that we failed to transition from crisis management to risk analysis in an orderly and forward-thinking way. And properly transitioning from that initial crisis management to a risk analysis and adaptation framework requires leadership, and it's essential for any organization to properly analyze and adapt to their risk in that process. So many sports industry players did a much better job at this than most universities. The question is why? I'm going to focus on a couple, and we'll get there in a minute. But let's think about kind of the standard model for most professional sports leagues. They have leagues, they have teams, and most of them are really comprised of small teams with decision-making authority. This is very helpful when you're going through a crisis management situation, not to have too many cooks in the kitchen, or as many universities do, try to manage by committee, an endless committee, an endless committee that never really gets around to doing a whole lot as far as making decisions. Now, with respect to other things to think about within organizations is the need to identify and understand our key stakeholders. In sports, that would be the athletes, of course, the coaches, medical and training personnel, administrative personnel, media partners, sponsors, fans, officials, and government regulators. For higher education, it's students and professors. But beyond that, we have our administrative personnel as well. And yes, we have media partners, sponsors, local communities, academic and industry partners, government regulators. We need to think about all of our stakeholders when we're going through risk analysis and understanding how we can get from crisis to adaptation. One of the key ways we do that is by getting the best data possible and updating it as particularly new data is available, which was a recurring thing throughout this pandemic and continues to be recurring as we learn more about the virus, about transmission, about the latest thing going on with the inoculations, the oh goodness, the stuff we put in arms. I can't even think of the right word. Apologies. Anyway, we seek solutions from our experts across industries and disciplines. And one of the key things, though, is really showing that leadership. Don't just follow. And this is something that the sports organizations did a much better job in, and that is identifying how they needed to forge a path forward. Many universities I know and people I've talked to in the administrative realm said, well, let's look and see what the other universities do, and then we'll let them take the lead. A lot of waiting. But in the process of not just following, we need to understand our product and then find differentiated solutions for our product. So just as in the sports industry, baseball and boxing had to come up with different solutions, within our universities, we also need to come up with different solutions for our different products. So let's talk about Major League Baseball and what they did quickly. Now, in March 2020, after starting spring training as the pandemic was starting to develop, Major League Baseball in the United States canceled all their baseball activities due to COVID. In May 2020, May 10th precisely, Major League Baseball proposed a comprehensive testing and hygiene guidelines to negotiate with their union. Now, I want to point out that this just didn't come out of nowhere. As soon as Major League Baseball knew that the pandemic was coming their way, they immediately started to consult with leading scientists, medical professionals, and different people in different industries who had expertise on dealing with crowds and all different types of things that you might think of as being beyond what sports leadership might normally be addressing. Despite COVID hitting various organizations, offices, and players, Major League Baseball took a study that they started in May or ended in May. So they actually started a study in March and ended it in May, going a study with respect to all of their employees and all of the baseball organizations that engaged in antibody testing. And they continued to push forward with different testing organizations, with labs, and with medical experts to determine exactly how the virus would be transmitted and how they could protect themselves, their customers, and all their stakeholders. This was in early March, April, and May of 2020. I wonder how many universities were doing the same thing. Now, on June 10, 2020, the decision was made that all announcers would broadcast games remotely. Once again, this is part of the differentiation of different stakeholders. We know that athletes have to get on the baseball field to play. They figured out that, well, broadcast announcers actually could just take a video feed or multiple video feeds and announce the games from their homes as they deliver the product on television. In June 14, 2020, Major League Baseball and the union set out a 101-page manual for health and safety protocols for the 2020 season. Players and umpires were allowed to opt out of the season and keep their jobs. I want to point out that they worked closely with the athletes, the coaches, the players, the umpires, with the media partners, with governments, and trying to come up with ways that they could work through this pandemic. Now, in late July 2020, games began in empty stadiums. The New York Yankees began daily testing, and each team was required to have a COVID compliance officer with teams on the road to make sure everyone was following the rules. Okay, but what they did is they didn't just wait for government officials to tell them what to do or what was safe. They actively worked to determine how they could safely and reasonably move forward with key attitudes on risk analysis and not risk avoidance. So risk analysis factors, and these would be general for any organization, but of course, I put the physical risk right up front for COVID, actual physical risk, medical risk in this case, physical health, and of course, as we went further into the pandemic, mental health, thinking about those harms to individual stakeholders. Then as a lawyer, of course, I had to put legal risk second, but reputational risk as well and economic risk, the bottom line. And then we have to weigh that against, well, the satisfaction of stakeholders that's needed to meet organizational objectives. And don't forget that they're diverse needs. Now, remember that individuals, when we're going through any type of risk analysis, we usually factor in their personal emotions, their personal pros and cons. But particularly in an environment like a pandemic, well, where individuals, their family members might be directly impacted, emotions can cloud what's going on. So it's more important than ever that we rely on clear thinking using the best analysis possible. Okay. Now, when do you think this picture was taken? This is a picture at an American football game in the state of Florida. Giving you a second to think. And it was just taken last month. Wow, isn't that crazy? During the pandemic, because it's not completely over. There's still cases spreading, and we had this picture. Well, despite this emotion, oops, I hit the key. Let's go back. Sorry about that. Despite emotion-driven fear-mongering by many experts and much of the world media, professional sports organizations, including United States university programs, have filled stadiums to anywhere from 20% of capacity to 100% of capacity this year. There have been no reported super spreading events, not one. Some people have come out with COVID, but not in a number that is beyond what would have been expected if they hadn't attended the events. And this is not an accident. Risk analysis processes identified the way forward all the way last year when I was talking with people involved with various sports organizations within the US. As far as last summer, over a year ago, they already knew that they could safely get back into the stadiums if they followed certain protocols. It was just a matter of convincing government officials in the world that it could be done too, because the science was already clear. All right. Now let's talk about differentiation. I just talked about Major League Baseball on one hand, but on the other hand, there are lots of other sports that are out there. And this is a picture of some UFC fighters. And by way of full disclosure, early in my career, UFC was one of my clients. I helped to write some of their earliest contracts back in the day. Now with UFC, there is definitely a potential for people in that close contact to be transmitting all kinds of diseases, not just COVID, to each other. Now, athletes, in this case and in many other cases, are in close contact, much more so than professors and students, or students and students in an average classroom. But it's hard to avoid the possibility, of course, of saliva or other fluids causing transmission of disease. Nevertheless, and this is quite remarkable, UFC went ahead and kept their sport going after a pause of less than a month in early 2020. They consulted with their medical professionals, their scientists, and they came up with an approach of essentially having quarantine bubbles for their athletes and the teams around the athletes. And they started to put their product back online in very short order and kept operating. Approximately a year later, in May 2021, this year, they had first full capacity crowds indoors. Now, I'm not necessarily saying it was good or bad or amazing what they did, but what they did do is they went through a process that led them to believe that they could do this safely in consulting with medical professionals and in consulting with various types of industries on how to make it so that they could have as sanitary of a situation as possible. And one other thing that's important to note, though, if you look at the people in this picture, I think it's fairly certain that they have higher risk tolerances than most professors and most university administrators. So it's not shocking that with their higher risk tolerance, that they were a little more forward-leaning into adaptation during the pandemic. Now, with respect to differentiation, there are lots of other sports we try besides, of course, mixed martial arts or baseball or American football, which I've mentioned already. Here a picture of tennis, swimming, badminton, gymnastics. Each one of these has its own risk profiles just generally as far as what types of injuries athletes can have. But ultimately, they are all different. But one of the things that athletes and sports organizations are used to doing that maybe universities are not used to doing is actually consulting regularly with medical professionals and scientists and all types of experts on how to improve their product and make it safer. And so they had relationships built in that they were able to build upon as they went into the pandemic. So ultimately, when we're talking about sports, we do need to think about the satisfaction of their stakeholders' needs to meet their objectives. Now, in talking about all these different sports, I can't tell you that all of them have done it right. And going back to UFC, did they do it right? It's hard to say, but once again, they and others didn't wait for COVID to control them, but they pushed forward to try to use the best data and methods available to them and then make adjustments as better, newer data became available, including some that they generated themselves through their own hit and miss experiments. Now, in crisis mode, going back to early 2020, we went online, and did many industries. But too many, in my opinion, stayed there too long. And with this sledgehammer approach, we ended up making it so that various disciplines were really shortchanged, and various stakeholders were shortchanged. Frankly, going online was great at first for allowing us to at least deliver some of our product line, but then the imagination kind of stopped. And it's proven very destructive, this idea of going online and staying online, and online's the answer for so much. It's been destructive to maintaining the integrity of effective teaching, learning, research, and broader engagement with our local communities and the world community. And has also failed to compensate for key social aspects of what universities do. So we need more refined approaches for different disciplines, just like different sports need more refined approaches when we're talking about our courses, our research, our programs, and our other products. So when we're differentiating, and this is a slide I actually used in a presentation I gave at our conference a year or so ago, the idea of product differentiation even online. Which products can be delivered most easily online? Well, the theory courses, of course, legal theory, engineering theory, music theory. What's really difficult to deliver online? Well, of course, try doing a chemistry lab online. Try putting a symphony together online. Very difficult. As one of my mechanical engineering colleagues told me then, he said, doing labs online is a complete disaster. It is an impossible situation. Now, some universities at that time decided, hey, we'll try to figure out a way to allow people back into the laboratory. And there are lots of ways that we could have safely done this much more effectively, much earlier in many educational institutions, particularly getting into labs. But let's face it, many labs, you've got clean rooms and people who are socially distanced and already masked up by nature. The fact that we took some of those things offline is actually quite startling if you look back in time. But even at the time, there were some of us who were asking, why are we taking such a sledgehammer approach? Now, in international education, with respect to product differentiation, once again, let's think about our products. Teaching, we have online and in classroom. We also teach in fields and in labs. How were these different types of teaching impacted by COVID? And I'd like to ask, as you look back now, could we have done it differently? Using just general risk analysis factors, could we have come up with better solutions and adapted better? Research, cultural activities, industry and academic cooperation, I'd ask those same questions. We could have whole conferences on those. I'm going to conclude by talking about the Olympic moment. In 2022, I mean, in 2020, they said in 2020, the Olympics were almost canceled, but were put off. They came up with a solution, at least, to put the Olympics together in 2023. And I feel this was really important, particularly for the athletes who've been training their whole lives to get there for their Olympic moment, because Olympics come only every 4 years. And for so many athletes, whether it's the Olympics, professional sports, or other sports, they have a very short window where they're at peak performance. Maybe a year, maybe 4, maybe 10. But for most athletes, it's only a few years. If they'd missed their window, they wouldn't be coming back. And many of our stakeholders, particularly our students, have Olympic moments every year. Students engaging in their leg of the final leg of their PhD research. International students who have made that big trip that was going to be a culmination of so much of their language studies, or help them to collaborate in a project they've been working on for some time. And then professors, of course, who need to use or lose certain research or certain funds or other things that might have just been lost, and their Olympic moment disappeared with it. Part of what we needed to think about better, I believe, is triaging and figuring out what were the most critical needs, who was going to be most harmed by what we were failing to do, and figure out ways to do better. Anyway, to the extent that we can avoid losing our students and our professors and our other stakeholders' Olympic moments, let's do it. And in the future, figure out how to triage and differentiate those who need or require a better solution for our stakeholders now and in the future. Thank you very much. Appreciate the opportunity to give you this presentation.
Brilliant, Troy. Thank you very much. Yeah. Okay. First question.
Mm-hmm.
By the way, it's over, Troy. You did it. Great job. Thank you very much.
Thank you, Lorne.
Many venues and companies are now requiring proof of COVID vaccination before entry. Is this something universities should think about?
Wow. Okay. That's a big, loaded political topic. So I'll try to be as judicious as possible in my answer. I'll think about it partly from my own personal perspective. And I'll just tell you, I was vaccinated way back early in this year. And what we were being told about vaccinations at that point in time was that they were 95% effective, 90% effective.
Glitch here. Well, this just gives the audience time to submit your questions. Panoramic views. Oh, he's going to come in here. It just proves actually we are.
Not that far away.
And we're both vaccinated, so it's no problem, right? Because in Korea, I tell you, this is very strange. We're all still wearing masks. Everybody around us here in the studio here is in masks. So Troy, about vaccinations, you were saying.
Well, as I was saying, we continue to get just data about vaccinations. And so that, going back to my point about getting the best data possible, we continue to get updates on that. But as far as organizations requiring vaccines, just from a risk analysis standpoint, I am thinking about an example in the United States, in the Washington State University, among other public employers in the state of Washington, recently fired anyone who wasn't vaccinated. And one of the most high profile, it's going back to the industry I was talking about, which is college football. And they fired their football coach and most of their coordinators as a result of that. And as I was reading more and more about Washington State University, I learned that well over 95% of people there and over 98% of employees were vaccinated, which then just led me to ask this question. And this is a question that I think needs to be considered, which is, at what point do you reach herd immunity? And if it's been reached, then why do you fire employees or restrict people from getting in? And I'm not an expert on vaccinations, but I think it's those types of questions that we just need to think about and be very careful. And I'm particularly concerned about, for example, ending people's careers. I don't think that's something you do lightly, or ending students' educational opportunities without thinking very clearly about whether it's absolutely required for them to do so, particularly if you've reached herd immunity, for example. So that's just my personal thoughts on that.
Thank you. Now, Alison wrote in, interesting, thank you, Troy, our university's risk manager, left during the pandemic as she was so exhausted and stressed. Do you think universities actually resource this properly or just follow their extreme risk aversion culture? Are universities too slavish to diverse and, to diverse and powerful stakeholders? See, I'm reading this slide too.
Yes, I think, well, it's not surprising that the risk manager left. I'm sure risk managers left a lot of different organizations during the pandemic. I think they weren't the only ones to leave because they were exhausted and stressed. But I think that universities don't necessarily resource properly in dealing with crisis management in general, as far as having your university risk manager. These are the types of positions, though, that not just universities, but many large organizations fail to properly resource. And then they're shocked when a crisis comes and they point to that one person and say, well, why didn't you handle this better? So I absolutely agree that there's a huge amount of under resourcing within universities, but I think risk averse culture within universities is just remarkable. It's over the top. Yeah, it's endemic. And I've worked in a lot of different industries, and there's nothing I've seen, even working in the US government, they were less risk averse than most universities are. That's saying something.
Okay, I have another one. Although universities are on the cutting edge with research, they definitely lag behind as trend setters. Can this ever change?
Well, I think, even in the marketing presentation, this became quite clear that, universities aren't necessarily that great at being trendsetters. We do have specific programs within different universities that have been trendsetters, and I think we see this around the world. But in order to be trendsetters, you really have to think about, the ingredients for entrepreneurship. And typically, the only way that large organizations can be successful in entrepreneurial aims is by somehow breaking off certain organizations or structures from the main body and allowing them to develop different culture, particularly a culture that is less risk averse. But that's my thoughts on that. There was a second question there from Allison. Yeah.
The difference, Alison again, the difference I see between HEI and other industry is the plurality of aims. So much easier to know what you are trying to achieve in business.
Absolutely right. I mean, some businesses, of course, have plurality of aims as well. But in higher education, the first thing people think about is, of course, going to universities for education. But we have so many different disciplines that have so many different methods for teaching, and and we have so many different stakeholders, and so it does make it difficult. I like to draw the comparison, though, back to the Olympics. And in the Olympics, you have a remarkable number of different stakeholders, not just athletes, but media partners and others, and they have to pull these things off. One of the things that the Olympics does, though, is they'd allowed the different sports federations essentially to come up with their own rules. And to a certain extent, universities, I believe, that decentralize and allow, for example, different departments to come up with their own ways to move forward. For example, chemistry come up with ways to work in chemistry labs more effectively, and entomologists figure out how they can gather and catalog their insects more effectively during a pandemic. And these are all things that were done in different universities.
Very true. Very true. So I have one last question, and it's kind of turning everything around. like this one, was trying to look outside. Well, Troy, do you think there is anything that the business world could learn from universities, how they dealt with the pandemic?
Sure. I think there are things that organizations can learn cross-pollinating all the time. I mean, one of the things that universities have had to do is to do what we're doing right now, get online and figure out how to deliver a lot of content to audiences across computer platforms. And other organizations have done that as well, but universities have been part of the cutting edge in some instances in this regard. And I believe particularly in that area, there has been some work that was done by universities that's very much able to be looked at and should be looked at by other industries. Sure, there are other things too.
Fair enough. Okay, thank you, everybody, for hanging in there. This has been very, very interesting. A lot of information to process. I want to really thank, first of all, our speakers, Troy, right next to me here, and Alison and Claire. Can you imagine? We've done 3 very, very different topics, but all of them really talking about communication and differentiation and segmentation. So anyway, to be continued. So many ideas and insights, so much to think about and so much to work on. For sure, we need to keep looking outside so we can develop inside. We need to take care of ourselves so we can help others. And we need to strengthen our priorities so as universities, we can take real responsibility to protect the future. Thank you everyone for joining, and please stay safe. Thank you very much. Bye-bye.
Just walk, don't walk tonight. 'Cause we don't need permission to dance. There's always something that's standing in the way, but if you don't let it phase you, you know just how to break. Just with the right vibe, yeah. 'Cause there's no looking back. There ain't no one to prove we don't got this on lock, yeah. The wait is over. The time is not, so let's do it right. Yeah, we keep going and stay up until we see the sun rise. And we say